How often would you say to check some like your levels yearly, just when you're sick? Like not, I mean, what's a,
Um, and kind of how I do it with my patients is the best way I can answer it, I guess, is if someone's presenting acutely, right, or presenting to my office for the first time, not necessarily acutely, but for the first time, if they're presenting to my office, they've got issues, because why would they come if they didn't,
right,
or they at least have symptoms. So
right,
then we test them, and I want to know those levels from the start, because again, if they're lacking, we can get sexy with all the stuff we want to do, but if we leave A or D or both deficiency, then we're in trouble. So we establish your baseline number, and if they're good, right, then cool, we'll just follow up while we're in the active plan of care with you. So like Elizabeth, your D was fine, right?
right.
You were in the 60s when we first met, so I don't need to follow that as often, right? So we're not going to test it at the midterm, but at the 3 months we'll test it again just to see where are you at. Okay.
Right.
And say at the midterm you're all good, we're high-fiving, you're spreading your wings, see you later. Well, then I usually say, okay, let's set an alert for say 6 months or 12 months out, just to do your yearly physical, but actually this one gives you real information that you can use.
Right.
And at that time we would be looking at things like this that matter, just to make sure, hey, in the last 6 months to a year, things haven't dipped. Because remember, these are all, your physiology is dynamic. So you could have a great vitamin D when you first present, and then you have a virus that lowers your vitamin D because you're using D to help combat the virus, right? Or you become inflamed for whatever reason. So say someone like Jennifer, when Jennifer started, Jennifer was,
A hot mess.
yeah, she was a little heavier than she is right now.
A little.
Right. So just the fact that you have more adipose tissue or fat tissue, adipose tissue is an endocrine organ. It's an inflammatory unit itself, right? So the heavier you are, that inflammation factory keeps spinning it out. Well, we have to use our fire extinguishers constantly, right? The heavier we are. So your D isn't a dose for her. If I give you a D dose, that same dose for her, if she's heavier, probably isn't going to keep her where it'll keep you, because she's using more.
Mm-hmm.
Make sense?
Yeah.
So in the interval between the last time we tested and the next time we test, it's not enough to never test again once we got it there, because we're never set there, because life and physiology are going to happen.
Okay.
Right. So we seek in the active phase of care, can we get you there if you're not there yet? And then what's the maintenance dose to keep you there, given say a fairly consistent life, right? But of course, life happens and exposures and all these things happen that we can't necessarily control. So we want to check in periodically to just make sure that things haven't drained you too much.
Got ya. Okay. Thanks.
Yeah. The last piece to that would be, because once we get your maintenance dose, so you're taking that, but if you now have an infection, that's not enough for the infection.
Okay.
Right? The maintenance dose was to keep you at baseline, assuming you're staying good. But now you layer on an infection and a greater demand, so supply needs to be higher, right? So it's kind of like,
Okay.
what are your vitamin D economics?